Hi Tonia, my name is Laura. I'm a student nurse today, and I was wondering if you can give me an S-bar on Mr. Light.
Yes. Hi Laura, how are you?
I'm good, thank you.
We have the patient in room 619, Glenn Light. He's 67 years old, male. He was admitted here on Tuesday. He has known allergies. He's alert and orientated ×3. He's here because he has hyperglycemia and a stage 2 ulcer on his right heel. He's being seen by Dr. Phillips. He's been insulin dependent for the last 20 years. He has no previous illnesses, injuries, or trauma. Or contagious diseases. He had a transurethral prostate resection 5 years ago, and he follows a diabetic diet, except for the last 9 months. He's been slacking off a little bit. He does not perform any additional exercise other than he goes bowling on Friday. He's a full code. And he's on an 1800 diabetic diet with 2 grams of sodium. All of his skin is intact. He has a lesion on his right heel that he noticed 3 weeks ago. It's kind of a blister. It's painful and it's increased in pain. He's tried some salt soaks, and those haven't been working for him. He is a fall risk, and also he is a pressure sore risk as well, so he'll have to be turned, but he is pretty independent, so we just got to make sure that he's turning himself. He has an IV in his right forearm, and it was put in on Tuesday. He has an A1C of 6.5, which is at the low, as a fair risk of his diabetic control. So we can question him a little bit about that. His white blood cells are decreased from 4.5, from 4.7 to 6.1. And his calcium is down 7.4, which should be about a 9 to a 10.5. Some of the things that we need to, that's outstanding that we need to cover or pass on would, he wants some diabetic teaching that he said, since he's been not following lately. He just wanted some more updated information. Some pain management. Wound evaluation will be coming. There is a consultant for that. We are waiting for his UA and his AST results as well. He was giving morphine at 1610, and he is currently in comfortable position. His vital signs, his latest one is they're all within normal range, and they're all within normal range, which is 128/70, 96 oxygen, and 16 respiration. Sorry, I kind of tripped over my shirt here. And it's, like I said, he's comfortable. Did you have any other questions? Oh, I'm sorry. And he had an AccuCheck, which is his glucose check, and it was 290.
Why is he getting this medication?
He's getting this medication because he's hyperglycemic, where his body doesn't produce insulin anymore.
And what is the effect on the body of the insulin?
What it affects, it stimulates the glucose uptake in the skeletal muscles and the fat, and it inhibits glucose production.
Why would you question administering this medication?
Why would we question? When would I question it is when the glucose serum is below 70. His glucose is below 70.
Okay. And does the medication have a therapeutic serum level?
No, it does not.
Are there any vital signs that we should monitor?
Yeah, the vital signs that we should monitor are blood pressure, respiration, and pulse.
Okay. And let's see. Which physiological parameters should be monitored when the medication is being administered?
Excuse me?
Which physiological parameters should be monitored when the medication is being administered?
The physiological, we want to, not according to him, but if he has a thirst mechanisms where he's very thirsty would be one. If he's going to the bathroom a lot, that would be another.
Okay. And what interventions should be taught to the client to ensure the medication is being administered safely in the hospital and home settings?
I can't hear you, sorry.
Oh, I'm sorry. What interventions should be taught to the client to ensure that the medication is being administered properly at home and in the hospital setting?
In the hospital setting, we should educate him that he should eat right after he receives his insulin. So basically, having his food at the bedside table. And at home, we want to make sure he has an ID bracelet on at all times, rotating his sites, as well as if he's feeling ill, to make sure he frequently checks his glucose level.
Okay, and are there any side effects or potential adverse reactions?
Hypoglycemia and anaphylaxis. So hypoglycemia, and anaphylaxis, sorry.
Okay, and when will you know if the medication is effective?
When his blood glucose comes down to a more normal range.
Okay, well thank you. I don't have any more questions for you.
Okay. Do you want to go inside?
Sure.
Okay.
Hello.
Hello, how are you, Mr. Light?
I'm good.
Good. I have a student nurse here, Laura, with me today. Do you mind if she stays with us?
That's fine.
Okay, perfect. I'm gonna wash my hands. Can you give me your name, date of birth?
Glenn Light, and I'm 67 years old.
So how are you feeling today?
I'm doing pretty good.
Oh, good. Did you already eat?
Not yet. It should be here soon.
It should be here soon. Okay. I'm going to go ahead and check on that for you.
Okay.
Okay?
Have all that information there. Everyone can see that.
They're actually getting ready to bring it in. So,
Okay, good.
so it's a perfect time. I'm here today to give you your insulin.
Okay.
And it's Lispro.
Okay.
Are you familiar with that medication?
Yes.
Okay, perfect.
I'm gonna go ahead.
Do you have any known
For
allergies?
this part.
All right, Mr. Light. When you first were admitted, you asked for some information, so I'm going to give you some information on your diet.
Okay.
Okay. So you know that you're a 1,800 calorie count diet with 2 grams of salt. So I'm going to give you that information here.
Thank you.
Also, I'm going to give you some information as I'm preparing everything. I would like for you to look over.
Okay.
And it's on the actual insulin itself. So because you'll be going home very short, you'll be going home. I just want to make sure that we go over some of those things that you might have to do at home.
Okay.
Okay?
Thank you.
So if you can look those up over.
So we're gonna go ahead and put 20 units of air into our insulation to hold it down here.
I'm going to get my computer set up here for you.
Okay.
And I just injected everything in there, so I'm gonna just take some of that air back out. So you see how it will go all the way up? Oh, okay. Yeah, so that's okay. Nothing's contaminated or anything, so that's fine. Just gotta do. You can also just do it a different way. Just do 20. Oh, that's not okay. So you can just put your 20 right in here, right? Take that out. Go ahead and drop another 16. So it's just a separate thing. It's whatever you want. I'm just showing you both ways. I guess that's what you want to do. Oh, there we go.
Mhm.
Okay, good. So, we're gonna go ahead and just, so we went from our
I'm
NPH to our
looking
regular.
at the Bliss
We're gonna go back
Pro,
to our regular here.
and
We're gonna turn the tissue.
it's in good condition. Oops, sorry. And it's not expired. Okay.
And so,
Checking against the
I
MR.
already rolled this around in my hands to
MR.
make sure that it wasn't any sediment collecting in the bottom. This is the cloudy one. So we want it to all be evenly.
And the Lispro is listed there.
Do a little bubble. and-
Checking the order against the MAR, that they're receiving the Lispro. It is a fast acting, so one of the things that you'll see in here is that you need to have some kind of food or snack prior to injection.
Okay.
So go ahead and take the snack.
We got our 16.
Oh, a good snack.
And your blood glucose level today is 290, so you're going to be receiving 6 units of insulin according to your sliding scale.
Okay.
Okay.
We're gonna come back over here and recap our note. We don't want our name to go anywhere.
So I'm just going to verify that.
So then we can click it like that. So we've got all that. I'm gonna go ahead and wash my hands one more time.
Okay. For Lispro, the only way that you can ever take this insulin at home, or it's been given, is through injection only.
Okay.
And prior to this, I did call the pharmacist to confirm that that's what I've read in here, okay? So it can't give any other form.
Okay.
Okay. The time, we're giving to you 16, it's due now, so the time, it's current right now, so it's due. Let's see.
You got it in your belly last time, so
Where was your last
so
insulin?
we're gonna go ahead and just do it in your
On the top right of my belly.
Okay, so is it okay that we do it in the right?
That's fine.
In the bottom right? Now, do you know why we do that, the rotation?
Yeah, so basically.
No, I don't.
Okay, we do the rotation so you don't build up scar tissue in that area, so we move the injection site. So at home, that it's a pretty good safety measure to do that,
Okay.
so you don't get scar
Switch that up so you
tissue on the inside.
Got it.
subcutaneous like fat tissue, and then it won't absorb basically, so you won't even be getting your insulin. So maybe you've been getting it too close, and that's why you haven't been really therapeutic with your insulin. It hasn't been working very well. So just make sure that you do that. Okay, so go ahead and just push your belly real quick.
Nothing
Note
won't stay.
that your skin
And let me
looks
have your name, date of birth.
nice,
Gwen White, 67.
redness, is there any discomfort?
So we verified the right route, which is subcutaneous, and we're going to go in the lower right. We verified the time, it is current, you've already had your snack. You're the right person. It is prescribed to you.
Bam, done.
You have known unknown allergies,
Put this away in the
and we're going to give you 6 units of insulin.
Okay.
Okay?
Okay. All right. Well, I'm gonna come back and teach you about syringes and how to use them practicing later on. Okay. But go ahead and finish your dinner.
So I'm just gonna
put your call light. Let me know when you're through, so I can just document how much you've eaten. Okay. All right. So we're gonna wash our hands and then head out of your room. Chart something maybe. Was that a good learning experience for you? Yeah, it was nice. Thank you.
Okay. I'm going to
I'm gonna put a separate note.
I just need to get your numbers off here. I want to make sure that the computer matches everything. That's our little safety.
And then he's able to tolerate, the injection. And then we'll come back and reassess how much he's eaten. And then another important thing is rechecking his blood glucose, so that you want to kind of follow up with your work and what you've done. So,
And if my computer's
like I
good
said,
for
I'll teach him
me,
about syringes and kind of assess his knowledge, or ask him to teach back to me how much he knows about, like I said, the different places, because that may be an issue why it's not, because blood sugar isn't going down is because he's giving it the same spot, so that's something he needs to know. And then we're also doing a nutrition consult for him because he requested dietary consultation and probably wants to figure out a better meal plan for himself. So we're gonna do all that.
Okay. It verify. It's you're the right person with that right drug. So.
I think it's before you leave the room. Before you leave. I feel like I forgot where I go. I don't know if they did. Yeah, that was really long. I know that was annoying, but I wasn't trying to like forget anything. Like I just had to sit there and like, oh. And then with the charting, I forgot. I didn't know because I didn't chart the skin assessment before I did it. Then I was confused. Like I didn't give it. I don't like no.
I don't like the more of a scanner because when I'm doing an airport, I have the scanner.
Well, I don't like saying that I've given it or I haven't given it, and I have to hit save, and I didn't actually give it. I don't like that at all. That was confusing. I didn't know I was supposed to do that. Like we put right here, given my name, but I gave it at 20:07 before I even went in the room.
And because this is fast acting, like I said, you just have to eat beforehand, within 5 to 15 minutes.
Okay.
That was just like confusing.
Did you actually teach him the difference and teach him how to use the two insulins and draw them in the video? You said you were going to, but did you actually?
Laura, can you verify that that's
You can't charge the
6?
fact that you taught him.
Looks good.
No, I know, but I'm saying like right now you can't charge the fact that you taught him how to draw the
No. Okay, that's the thing. I don't know how. I messed it up last time. That's why like I didn't even know if I was doing that right. I'm like, now where do I charge my assessment afterwards? Oh, so we can just go through the last one, all that stuff in here.
Yeah, I tried to make him teach it before.
Oh, okay. Well, I mean, like, there's a lot of teaching.
Did you have any questions about the insulin after reading that?
No, I do not.
So, what are some of the what are some of the things about the insulin that you read that you could do at home?
That I can do at home. Make sure I have a snack. And if I am feeling dizzy or get blurred vision, something like that, I should check my sugar levels and eat something.
Okay. Perfect. I'm going to sign this that I did give you the injection. That's perfect. What about did you have any questions on your diet?
No, I just need to stop eating so much fast food and watch my salt intake.
Perfect, yeah, definitely. So any, like your bacons and stuff, you might want to switch over to maybe a turkey bacon if you like bacon a lot.
Okay.
Or do some alternatives. Canned goods is another high in salt as well. So you might want to switch over to fresh frozen.
Okay.
Okay. All right. I'm going to go ahead and put the bed down. Okay. Give you your call light. Are you comfortable?
Yep, I'm okay.
Perfect. Okay, and then I'm going to go ahead and do my documentation and of everything that we've done today.
Perfect. Thank you so much.
Laura, did you have any questions?
Yeah, I was wondering, is there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I did. I reviewed the blood glucose, all his vitals, as well as I had to confirm with the pharmacist because it is very similar. There's a human log and a humulin. I'm saying that right? And the Lispro is the human log. So it's a name issue. So always make sure you verify that you have the right insulin.
Okay, and did this information affect your decision to administer the medication?
Not well, yes, but no. It didn't. I had to make sure that I gave the insulin because of his high glucose count. However, if it was below 7, I would have not gave it.
Okay. And did this information affect how you administered the medication? Okay.
Okay, would you like to come out and watch how I documented
Sure.
in his chart?
Sure.
Okay, great. Oh, and I'm washing my hands.
Okay. Thank you.
You're welcome.